This episode is all about seasonal affective disorder. Recently, DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, has changed the name of seasonal affective disorder or SAD to depressive disorder with seasonal pattern. The new name isn't quite as catchy as SAD, but it does describe the condition more precisely. That's because depressive disorder with seasonal pattern is not really a distinct disease, but rather depression that worsens at the same time each year, usually in the late fall and winter. So let's first review depression. Depression or major depression is a serious condition where someone loses their sense of life being enjoyable. This feeling of malaise affects every aspect of their day-to-day life. Whether they are working, studying, eating or sleeping. The causes of depression are not fully known, but it's thought to involve a deficiency of monoamine neurotransmitters in the brain, like dopamine, norepinephrine, and especially serotonin. In depressive disorder with seasonal pattern, there's a strong relationship with the circadian rhythm, the internal clock that keeps your body in tune with the rising and setting of the sun. At the base of the brain, there's a region called the hypothalamus, and within it are a group of neurons located in a specific spot called the suprachiasmatic nucleus or SCN. The neurons in the SCN get information about light from optic nerves and use that information to run the circadian rhythm. The SCN relays that information to the pineal gland, a tiny cone-shaped structure near the hypothalamus. And when it's dark out, the pineal gland releases the hormone melatonin, which is chemically related to serotonin. Melatonin lowers your heart rate and body temperature, helping you go to sleep. When it's light outside, the pineal gland stops releasing melatonin, and that has the opposite effect by raising your heart rate and body temperature, keeping you awake. A risk factor for developing depressive disorder with seasonal pattern is having a sleep phase delay, which is when a person's body produces too little melatonin at night. This can be due to things like decreased sensitivity to changes in light, problems with the communication between the retina and the hypothalamus, and even exposure to external sources of light, like you might experience with late night computer use. A sleep phase delay can result in a person's internal clock having more than the standard 24 to 25 hours in a day, which means they may not be able to sleep until at least 18 hours after they woke up that day. Long day after long day, this pattern quickly becomes exhausting. It can be hard for anyone to adjust to the late sunrises and early sunsets of winter, especially those who live in higher latitudes. But for those with a disordered circadian rhythm, the shorter days seem to somehow interfere with monoamine production, causing the person to become depressed. Another mechanism that may be involved relates to vitamin D, which is largely obtained in a reaction that relies on sunlight. Vitamin D is involved in the synthesis of serotonin and dopamine in the brain. and decreased sunlight might push a vitamin D deficient person into depression. Both the sleep phase delay and vitamin D deficiency ideas hold promise, but they don't yet explain those few people who get depressive disorder with seasonal pattern in the summer. Symptoms of depressive disorder with seasonal pattern are similar to those of depression, including intense feelings of worthlessness or guilt and a lack of enjoyment in activities they took pleasure in during other times of the year. They may find it hard to concentrate and in severe cases experience suicidal ideation. For the depression to be truly seasonal, it must occur in the same season each year for at least 2 years in a row, and the symptoms must diminish or disappear with the new season. It's also important not to confuse seasonally triggered depression with depression caused by recurring psychological or social stressors, like having job pressures or living alone during certain months of the year. Treatment of depressive disorder with seasonal pattern usually includes light therapy, medication, and psychotherapy. In light therapy, a person sits close to an intensely bright light box for 30 to 90 minutes every morning. Unlike the light bulbs you would normally use around the house, light therapy boxes have light wavelengths that encourage the skin to produce more vitamin D. Antidepressants can also be helpful. For example, selective serotonin reuptake inhibitors or SSRIs can increase serotonin levels, and bupropion can increase norepinephrine and dopamine levels. Finally, CBT, cognitive behavioral therapy, can be particularly useful in helping people identify and manage their feelings. Alright, as a quick recap, seasonal affective disorder, otherwise known as depressive disorder with seasonal pattern, is a depression that recurs in the same season for at least 2 years in a row, and the symptoms must diminish or disappear with the new season. It usually occurs in the fall and winter months and may be related to a dysregulated circadian rhythm or vitamin D deficiency.